When we're thinking about the knee, we have to think that it's the connection between this femur bone, all these muscles, and then this tibia bone, the lower leg, and our fibula. So it's just the connection in between. It's a consequential joint, and we use a lot of our quads. If we're bending over and we keep doing this and grabbing things, we're just using the quads. We're not using the back of the leg. So what ends up happening is people get really tight quads. So all these quad muscles get really tight, and they're pulling on that kneecap, and they're pushing it in. Also thinking about the back of the leg, it's just like my shorts. If I'm tight on the back of my shorts, then it's pulling on the front. So I got pressure on this side, and I got pressure pulling up. And so I'm gonna get frays on that knee. I'm gonna get frays in the tendon, just like I would get in the shorts over time. I'm just consistently having stress on it. So we wanna loosen up that chain, and then we wanna reinforce that chain that'll fire different muscles. So we're thinking about the anatomy when we're doing this. We wanna loosen up this quad muscle. So what I'm gonna do is actually roll it out initially, and then I'm gonna pull it up. When I roll out the quad, I'm loosening up this tissue on the outside, I'm loosening up the tissue on the inside, and I'm loosening up that muscle on the top. We got 4 quad muscles, inside, top, outside, and then we have one right underneath it. And so if we can pull those that muscle tissue apart, then it's gonna be most effective. So first thing I'm gonna do is get right here, I'm loosening up. So we do about 10 swipes. Like, you want it to be a little bit tender. It doesn't need to hurt a lot. We just need to get some loosening. You can also do a massage gun on this. You just gotta respect the anatomy and where we're trying to get that looseness to happen, where we're trying to loosen up the muscles. I'm going here, I go on the top, 10 swipes, and then I'm gonna go on the outside for 10 swipes. I also wanna remember, I don't wanna put pressure on the inside of my knee right here. So if I'm hanging up or I push my leg to the outside, I can push my leg to the outside. I gotta be able to get on the outside of the knee, outside of the leg, and dig out that quad without allowing the knee to press inward. That's gonna put a lot of pressure on it. So these are really important things to think about, is what's happening to the knee when I'm trying to fix it and get some relief. Like, what's happening to it? If I'm putting more stress on it, then it's gonna be counterproductive. And so we always wanna tell our clients, like, talk to them about what are the mechanics of it and how we loosen it up. So I've loosened up the quad on the inside, the top, and then the outside. And then what I'm gonna do is actually come in underneath this muscle right here. I'm gonna dig these two apart. It's like, so I wanna loosen up the top muscle from the inside and the outside. And so what I'll do is I'm just grabbing onto this muscle and I'm loosening it up. You can feel the division of these muscles. So I'm pulling up with this hand. I'm gonna pull up right here, and then I'm digging right into the crevice in between the two muscles. I'm loosening that up. We want to do this for about a minute. I'm loosening up all this muscle tissue. It's going to take a lot of pressure off of my knee. So I want to think about doing 10 on the inside, 10 on the top, 10 on the outside, and then digging these things apart. It's the easiest to find on the inside, but then also on the outside, I'm pulling it up and away, just digging out that muscle tissue so I can loosen up. Now I've taken away that stress on the top. Let's get to the back. On the back side of the leg, we have our hamstring and we have our gastroc. We have our calf muscle. You can see that these guys are crossing each other right here. So where muscles cross each other, they tend to get tangled up. They get stuck together with fascia. And so we got to loosen up above and below. What I'm going to do is take a lacrosse ball and I'm going to loosen up the inside of that hamstring right here, putting pressure into it, loosen that up. Do about 10 swipes, be creative with it, right? So we can get up a little bit higher, 10 swipes. I'm trying to loosen it up. When we're looking at the anatomy, I wanna loosen up right here, loosen up right here, loosen up here, loosen up here, loosen up here. So I spend about a minute just working on those muscles on the back side of my leg, loosening them up. And I'm staying off to the side where the muscle bellies are. I'm loosening up the hamstring. And then I'm gonna come down to the edge. This is where I feel it the most. It's very tender right here. I'm splitting muscles apart and really grinding in that muscle tissue to take that stress off the back side of it. And then what I'm gonna do, I can't get like really good leverage on my calf right here. What I do is grab a rolling pin. And so even if you have a dough roller at home, we're just a rolling pin. We want to loosen up that tissue. You can use a massage gun right here too. I'd be pop, 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 just hitting that calf, but then also get in with a tool. And so I can loosen this up on the outside, loosen it up on the inside. You can also do it, that's a little bit more leverage, but I can do it just right here, digging that out. You can see where my calf's moving around. So I'm going to do 10 swipes right here, 10 right here, get a little bit lower, 10 and 10, loosening that up. So now I've loosened up the back side of the leg. So I get the top of the leg and then loosen up the back side of the leg. Let's get into the exercise. To really get that stress off of the knee, I need to be able to load the back of the leg so it can actually loosen up. So muscles that are weak and unused typically get tight on us. Our body is trying to create that stability. So overworked muscles will get tight and then underworked muscles. So we're trying to redistribute that load. The majority of clients that come in, they're using 90% of their quads and they're not really firing the back of the leg that well, especially the hamstrings. So when we're looking at the anatomy, we want to use the hamstrings and use the glutes, and then we're going to get a glide through these muscles right here, but using the hamstrings and the glutes primarily. So what I'm going to do is measure my foot length away from a wall, and then I'm coming back. My face is in line with my chest. I'm reaching back with my butt, touching. My weight is not on my toes at all. It's really important that when we're having knee pain and we work on this hip hinge squat, that we don't have any pressure on our toes at all. That's why we do it into the wall. So I'm reaching back. I'm allowing my chest to come down. I'm gonna do the same thing against this wall, reaching back, and I got that stability to push back against the wall, but my knee's not coming forward at all. Now, if somebody's dealing with back pain, sciatica, it's okay for their knees to come forward a little bit, but if you're dealing with knee pain, we don't want that knee to move forward at all. What happens is that these muscles are coming down and they're crossing the knee. So we got a tendon attachment right here, and then it attaches down here on the tibia. That pulls against it. And so if you think about somebody hanging from a ledge, if they have a really sharp ledge, so kind of like my elbow, if they have a really sharp ledge and that rope is fraying against it, then we're gonna have problems. We're gonna have pressure and irritation right there. When we straighten that out, if I had a straight elbow right here, that's not going to be nearly as sharp. And so if I had a rope going across it, it doesn't get as irritated. And so it's the same thing with this hip hinge position. If I'm coming forward like this, this is a really sharp area that's causing irritation, a lot of compression right there. I want it to be back here with my butt kicked back, and that's not nearly as sharp. What you're going to find is you loosened up that muscle tissue. When you start firing up the hamstrings and the glutes in this position, you're getting muscles firing that weren't firing before, but you're also keeping your knee in such a neutral position that it's not going to cause you irritation. So it's imperative with this exercise that we don't cause irritation to our knee. And it shouldn't. So, but we've got to allow the chest to come down. What I see often is that people get back and they keep their head up because they're locked eyes on the wall. You lock eyes on the wall and the knees start to shift forward. Now we've caused that irritation again. So if you do cause the irritation, I want you to back off, re-loosen up all that muscle tissue, and then really work on reaching back with the butt. Face stays in line with the chest like this, and I don't lock my eyes on the wall at all. And I'm firing this up. This hip hinge, it's been talked about in books. It's the most important thing that you continue to do. We've got to be able to move through our hips. Driving through our hips, it makes us use our glutes, which is the biggest muscle group in the body. So we've got to get this movement pattern down. When we have a really good movement pattern, we're not causing extreme stress on a joint consistently. What we see, the degradation in knees, is that we're loading through the knee all the time and we're not redistributing that stress up to the hip. When we redistribute stress and we're getting 50-50 from the knee and the hip, then we're getting nice loading and our body's able to get rid of the inflammation and it takes that stress away. And so I'm measuring my foot away from this wall, this table that I got for a wall, and I'm reaching back. So I'm almost parallel with the ground as I touch the wall. And then I push back forward with my hips, reaching back, push back forward. If you are doing this and you're not able to get the movement down, it's better to start a little bit closer to the wall. So I reach back and touch, come back up, reach back and touch. But you can see my lower leg is never moving forward. My knee's bending, but my lower leg's never moving forward. I should feel all this tension in my hamstrings and glutes. You do that consistently, those three things, really four, getting the calf in there, loosen up all that muscle tissue around the knee, and then fire up the hamstrings and glutes. You're gonna be taking stress off the knee and you're gonna feel a lot better. Subscribe to the channel. We'll give you more details on exactly what you need to do to fix your pain problems, whether it's your knee, your ankle, your hip, your low back, neck and shoulders. All of those things we attack here in the clinic. We have over a 90% success rate with all of those areas of the body. So we're gonna show you exactly what to do so you can fix this stuff at home. It's gonna help. Follow the program, refer back to the video. Subscribe to the channel and let us know exactly what videos you need to be able to get yourself out of pain. We have all the tools here to be able to fix this from YouTube. We'll see you in the next video. Get mobile and stay active.